This video is an introduction to the European Society of Endocrinology and Endocrine Society Joint Clinical Guidelines for Glucocorticoid-induced adrenal insufficiency. Glucocorticoids are widely prescribed to reduce inflammation. Long-term glucocorticoid use suppresses the HPA axis, shrinking the adrenal gland. Experts in Europe and America have jointly produced guidance on managing the complications associated with glucocorticoid prescription. Clinical questions were defined and the quality of evidence for recommendation was assessed. Grading of recommendation, assessment, development, and evaluation was used for this. The recommendations were based on good clinical practice and/or evidence. The guideline was drafted by a working group. It was then reviewed by 4 experts in the field. This was further open for comments from all members of both endocrine societies. The questions focused on assessing adrenal function and treating patients after long-term high-dose glucocorticoid use. Clinical questions 1 and 1A 374 studies were identified with 4 included. For clinical question 2, 873 studies were found, 5 were included. For clinical question 3, 843 studies were identified and 3 were included. Before reviewing the guidelines, it's important to understand key terms. Short-term glucocorticoid therapy lasts under 3 to 4 weeks. Long-term therapy is beyond 3 to 4 weeks with higher doses. Physiological daily dose equivalent is a daily glucocorticoid dose equivalent to the average daily cortisol production. Supraphysiological glucocorticoid therapy is the dose greater than the physiological daily dose equivalent. Glucocorticoid tapering involves gradually reducing the steroid dose. Initially, it's guided by the underlying disease, also known as the therapeutic taper. Later, it focuses on managing glucocorticoid withdrawal and adrenal insufficiency, known as endocrine taper. Glucocorticoid withdrawal syndrome occurs when symptoms arise from dependence on high-dose glucocorticoids while tapering the steroid dose. These symptoms are unrelated to the original condition treated with glucocorticoids and are not caused by the untreated adrenal insufficiency. Please watch the next video in the series for more information about the guideline.